I mean, that's the thing about this whole thing is that it's not impossible to have a normal conversation about that. I mean, what I can tell you is that street people often might check themselves into the hospital or something like that, and there's underqualified workers in the mental hospitals, like over the past 20 years or so. They get into these deliberations with their patients, and they get into these deliberations, and the patient is supposed to be communicating like a patient, but it's communicating like a communicator, you know, and they want to put their hands all over somebody that starts communicating as if it was a communicator, they simple explanations. That's the thing about it is that there's nothing to be said for that. And there's people that made mistakes inside those mental institutions and the hospitals. It's really simple information. They're not perfect. They make mistakes. They made mistakes. You can't justify that. You don't talk to the communicator about the patient, and so they have work to do because they're not quite up to par. And we're coming out of the really, really dark ages in that system. And so I don't see why we're going back. But no, you wouldn't necessarily be one of these people who that doesn't know why this person in the mental hospital is even talking or expressing themselves or having needs or something. You know what I mean?